I'm going to demonstrate how to do the thigh thrust test, the Gaenslen's test, and the FABER's test. So I'm going to do the thigh thrust test first. You're going to want your patient laying supine and relaxed. Then I'm going to have the patient, or I'm going to lift up the patient's leg to 90 degrees of hip flexion and 90 degrees of knee flexion. Then what I'm going to do is I'm going to palpate and put my hand right underneath his sacrum. And what I'm going to do is I'm going to provide a anterior to posterior force. And what I'm doing is keeping that sacrum stabilized while moving his ilium. A positive sign would be if there's pain, and that would be indicative of SI joint pathology. Next test, I'm going to do the FABER's test. So the patient will be laying in a figure 4 position. I'm going to put one hand on their ASIS to keep it stabilized. When the other hand, I'm going to put it on their opposite knee. I'm just going to provide a passive overpressure. And a positive sign would be, or there's multiple positive signs. If one positive sign is PSI, if they have pain in the PSIS, that'd be indicative of a SI joint dysfunction. If they have pain in their groin, that'd be indicative of a just tight adductors. Or if you also can notice that, like, if their knee is off the, like, has like a significant gap between their knee and the table, that'd be indicative of either tight adductors or just tight joint or a tight joint capsule. And then the last test would be the Gaenslen's test. So you're going to want your patient to come to the edge of the table. And I'm going to instruct him to pull and hold his knee to his chest. And then I'm going to provide a passive overpressure on the one knee and then also on the other knee, and kind of like widening it. And then a positive sign would be they have that pain back in that PSIS SI joint area, and that just be indicative of a SI joint dysfunction.